Hi, my name is Jennifer Lowe, and I'm an ophthalmologist in Miami, Florida, USA. I wanted to thank especially Dr. Omid Karmani for the kind invitation to speak with you today at your spring symposium. So my topic today is presbyopia eye drops, game changer. These are my financial disclosures, and I do consult and speak for several companies that are in the presbyopia field. So presbyopia, it's a big problem. We know that over 120 million people in the US and 2.1 billion people, worldwide are suffering from presbyopia. The prevalence of presbyopia has been estimated at nearly 80% by age 45 in North America alone. And a shocking statistic is that 16% of these individuals live without correction. An even more shocking statistic is that 10% of presbyopic patients were willing to trade 5% off of their life in order to get rid of their presbyopia in a study done by Luo in the American Journal of Ophthalmology. 40% of patients are actually looking for an alternative to the traditional glasses. And as we know, there are no great surgical options. Presbyopia has a significant impact on the quality of life. And while we may have several current solutions, all of them tend to have drawbacks. Glasses, as we just mentioned, are inconvenient for patients, and they can negatively impact self-confidence, and also there's especially difficulty now with mask wearing and fogging. Contact lenses have issues with compliance, risk of infection, and dry eye. And there can be adaptation issues because in order to get rid of presbyopia with contact lenses, one must often wear multifocal contact lenses or use monovision. One could have surgery, have lens exchange surgery. However, we know that the implants today, while they have advanced greatly, they are not necessarily perfect for every patient. Corneal inlays have extensively been studied. However, unfortunately, due to complications, they are no longer viable, at least in the US market. And monovision laser correction has been around and has been probably one of our best options so far. But as we know, this also has issues. The outcomes can be less predictable, especially in hyperopic patients. And there's a loss of binocular vision and depth perception. And again, the treatment may not last for very long, depending on the patient's development of a cataract. So what are the drawbacks of monovision? Well, simply put, Dr. Dan Dury showed that even with only 0.75 diopters of monovision, stereopsis was significantly reduced. So again, patients are still having to compromise something in order to see up close. So are there other options? What about eye drops? Well, presbyopia drops, form and function. The primary goal, of course, would be to help patients regain vision at near. The secondary goal, however, would be to gain a sense of freedom and youthfulness. While you're sitting around the office table discussing a project, you want to be able to see your computer, cell phone, and iPad without always having to reach for a pair of glasses. 88% of patients in a study indicated an interest in drops, and this was consistent across age, gender, and income. So presbyopia drops, how would they work? Well, most of the studied drops are currently focused on the pupil, and they are miotics. The concept is using the pinhole effect to increase depth of field. However, it is important that we would need a rapid onset, good duration, efficacy, safety, and convenience for our patients. And of course, as we know, there can be some side effects from any medication we give, including miotics, such as a myopic shift, headache, brow ache, and hyperemia. The pinhole effect may improve or extend our depth of focus. As we can see in these diagrams, the young eye is able to accommodate from far to near. However, the presbyopic eye has a blur as the lens cannot accommodate. With meiosis, we have a smaller pupil that extends the depth of focus, making items near more clear. So who would be a good candidate? Well, some ideas that I've thought of would be emmetropes, because they're probably the least comfortable with vision correction surgery. They already have great vision at distance, and we don't want to affect that. There's also the post-LASIK emmetropes, and these candidates are especially interested they've already had surgery previously to get rid of glasses, and the onset of presbyopia is not a welcome condition for them. Hyperopes as well could be helped because they have trouble seeing far and near. And so gaining any type of improvement in vision could be helpful. Pseudophakics as well, while they may have clear distance vision, if they have a monofocal lens, they may be disappointed about having to wear readers. So this could also be a good option for them as well. Some things to watch for, and I wouldn't say it's an absolute contraindication, but more of a relative contraindication, would be we should be aware of our patients that do have long axial length, such as high and a history of high myopia, or a history of retinal tears. So again, not that this should be a complete contraindication, but I think our patients should be examined well and counseled about possible risks. So how many companies today are working on drops for presbyopia? Well, by my count, we have at least 8, but there's probably even more in the pipeline. As many of you know, Allergan recently had the first approval in the United States of a drop called Vuity, and it is 1.25% pilocarpine in their proprietary FAST technology. There are several other companies that are close behind, also working on miotic drops as well. I like this graph because it helps showcase and identify the different types of miotic drops that are being examined and their different mechanism of action. It also shows and highlights where in the stage of development each company is at. And as we know, Allergan has reached the finish line and has received approval. Orasys is close behind. Both the Orasys and Allergan drops will be cholinergic agonists using pilocarpine and proprietary vehicles. But we do have some companies working on slightly different agents. Visus is looking at brimacol, which is actually a mixture of brimonidine and carbachol. And Lens Therapeutics company is looking at a product called aceclidine. Again, they're all working in the miotic space, but they have slightly different mechanisms of action. Ocuphire has an interesting combination drop, actually using a combination of Nixol and pilocarpine. So they're utilizing the alpha antagonist and pilocarpine mechanism of action. More to come on these exciting drops. So what are important characteristics for a presbyopia eye drop, or what would I want in my eye drop for presbyopia? Well, of course, we want it to work. We need to have improvement in near vision. We need it to be safe. We do not want headaches, and we don't want to have an effect on night vision or driving. Duration is important. Longer is always better. Something that could last an entire workday would be nice. And rapid onset, of course, in order to achieve our improved vision quicker. Also convenience. Minimal dosing requirements would be important, as we know that compliance starts to decrease the more oftentimes patients must take a medicine. Allergan's phase 3 study was a Gemini 1 and Gemini 2, and the primary and key secondary endpoints were actually met with no compromise in distance vision, which was really exciting. In the Gemini study, they achieved a greater than 3-line improvement in mesopic distance-corrected near visual acuity with a rapid onset of 15 minutes. 92.5% of study participants achieved 20/40 functional vision or better in photopic near vision on day 30. So this is important as well. We don't want them just to improve by 3 lines. We actually want the improvement to be functional for patients at near. And even more importantly, possibly, is that there was no loss of mean distance vision. Adverse events were predominantly mild and transient, and the discontinuation rates were low. Also, another important comment is that they found in the study that pupil response and return to baseline diameter within 24 hours were maintained from day 1 to day 30. So there was no evidence of tachyphylaxis, and the pupil returned to baseline after effect wore off. I wanted to end my talk with a classical clinical case scenario to highlight how, as ophthalmologists, we're presented with issues of presbyopia every day. In your surgical clinic, in walks a patient who had myopic LASIK at age 30. They're currently age 45, and they still see great for their distance. They're 20/20 each eye. However, they come to you thinking their LASIK has worn off because they can no longer read without glasses. And as you can see from the topography here, there is central flattening on the topography. So what options do we recommend? Well, as I've listed here, there are many, many surgical options, but probably not a perfect one-size-fits-all. Also, there's, of course, non-surgical options such as spectacles and contact lenses, but as we discussed earlier, these have their issues. Well, hopefully drops for presbyopia might be a solution for us in the future. And in summary, Drops for presbyopia, they represent an exciting technology for patients who can hopefully experience the benefit of reducing the need for glasses without undergoing surgery. In the meantime, it can serve as a bridge for patients that could still be potential refractive candidates, but maybe they're not quite ready for that yet. And maybe we want to give them a little more time. So again, this isn't necessarily reducing our options as surgeons, but helping our patients be proper candidates prior to surgery. We do need to be aware of potential side effects and contraindications for the drops as described. But in summary, I think this is an exciting time for us to be eye doctors. Thank you very much.